make changes in for me? Oh, okay, great. Good afternoon. My name is Susan Berger, and I'm waiting for my slides. Great. Okay, there I am. Susan Berger, FPA, which stands for Family Peer Advocate, and that is the credential that I'm going to be talking about. Do I? Okay, great. Oops. Okay, great. So I work at Families Together in New York State, which is a statewide family-run, not-for-profit. It was formed in 1995 by a dedicated group of parents and parent advocates to unify family voice across the state, along with managing the Family Peer Advocate credentialing and training program. Families Together also works to encourage advocacy on the legislative level, promote principles of family-driven care. It supports Youth Power, which is our statewide youth organization, and provides technical assistance to programs across the state who work with children and families. Our state outreach is strong. We have a membership of approximately 1,000 individuals and a listserv of close to 3,000. So, family peer support has a long history in New York State. It's been available to families for over 25 years. Within the last 10 years, though, there's been a big push in New York State and throughout the country to formalize the work and to develop family peer support services into a recognized profession. An important step in this process for us in New York State was the development of this consensus definition for family peer support services, which includes activities that fall under 6 broad categories: outreach and information, engagement, bridging, and transition support, advocacy, self-efficacy, and empowerment, community connections and natural support, parent skill development, and promoting effective family-driven care. An expanded version of this definition is on the Families Together in New York State website, and that will come up at the end. So how does family support help? Family peer advocates are different than other workers who support families in that we are veteran families with lived experience navigating systems on behalf of our children. There have been, we have understanding of firsthand experience and the difficulty of raising a child with very difficult and serious challenges. The difference between family peer advocates and other people who work in the field who have children with serious problems is that we use our experience specifically to help families. So we talk about our experiences with families, and that is a part of the job that's expected. So training along with lived experience is what makes the family peer support role so powerful. And in family support, the focus is completely on the family and on the caregiver, actually, not the family, just the person providing care. So usually that's the parent on behalf of the child. So this strong focus helps to reduce guilt about needing more help than can be offered in general services, where the parent is considered a collateral. And it helps parents to take the time they need to question, to learn, and to try the new skills that they're learning. Experience and research has shown that when parents engage with the system and become more active partner with providers, there are better outcomes for the child. And family peer advocates are able to use their lived experience along with their training to help parents engage in a meaningful way with providers. Until recently, formal data on the impact of family peer support has been mostly anecdotal, but I know for myself it made a big difference for me in how I was able to partner with providers and how I was able to care for my child. Currently, there's emerging evidence, an evidence base for family peer support. Data is being collected in New York State, and I'm sure across the country on this. In New York State, we're using the Family Assessment of Needs and Strengths, which is the FANS, and the Office of Mental Health uses the Child and Adult Integrated Reporting System, or CARES. And that's how we're moving forward with attempting to collect some useful data on family peer support. As family peer advocates, we are increasingly being used to assist parents to navigate multiple child-serving systems for children and youth with complex health, behavioral health, and developmental needs. And the need for formal credentialing process became clear and with support from the Office of Mental Health, a formal credentialing process was started in 2011. So we are pretty new to the business of credentialing our workers. Overall, family peer advocate credentialing has a group of requirements: proof of age, proof of education, and something that we are using right now is a waiver. We require a high school education, but if the person doesn't have a high school education or can't prove that they have a high school education, we have a waiver in place for that. 1,000 hours of work as a family peer advocate, proof of lived experience, and completion of the PEP or PEP module training, 3 letters of recommendation, and an agreement to practice according to the Code of Ethics. To meet the needs of New York State's changing healthcare, we have had to redistribute the credentialing requirements for the family peer advocates, and this slide outlines those changes. We now have a new provisional credential that gives advocates the opportunity to get credentialed before getting a job and gives employers the opportunity to hire trained and credentialed workers who they are able to bill for from day one. To make this change viable, we redistributed the credentialing requirements for work experience, recommendations, and training. The provisional credential is valid for 18 months, and during that time, the expectation is that the family peer advocate goes on to meet the requirements for the professional level credential. So to be eligible for a professional level credential, an advocate needs to meet all of the requirements for a provisional credential, plus provide a certificate of completion for training, verification of 1,000 hours of supervised lived experience working as a family peer advocate, and a letter of recommendation from a supervisor. And we've also updated the renewal process, so the expectation is that there are 20 hours of continuing education over a 2-year period. PEP was developed in 2005 to meet the growing workforce, and it's required by all credentialed family peer advocates. PEP is unique in many ways. It's groundbreaking because it was developed specifically for individuals with family peers doing family peer support work. Another feature of PEP is that sets it apart from other trainings is that it was developed by clinical partners, family peer advocates, and researchers, and is delivered by a team of family peer advocates and a clinical partner, modeling partnership. PEP is based on core competencies that were developed with statewide input from people doing and supervising the work. PEP training has had to evolve to meet the needs of the changing healthcare environment. So we had to change from our current system, which is 40 hours of in-person training and 12 one-hour consultation calls, to something that is more accessible for people who are not already working in the field. So we've developed an updated PEP-M training, and the focus is on improving access for people who are interested in doing this work because we need to increase the workforce. we now have a set of online modules, 2-day in-person component, and again, the 12 one-hour consultation calls. And here is our set of modules for our level 1 training. Each module covers a specific principle or skill and overall represents the core skills that are needed to do the work. There's a quiz at the end of each of the modules that advocates must pass to move on. Here's the level 2 training, and it has 4 components. There's the online modules of advanced skills, evidence-based topics that were identified as areas of competence. There are elective modules that cover systems that parents typically need help in, and 2 days of in-person training and consultation calls. So the Family Peer Advocate, as a lever of change, especially in New York State, there's been a positive impact on both the systems that serve families and the field of family support itself. It started to change the way the healthcare system and social services system think about family peer support and the family peer support services workforce. Having a credential has added legitimacy, respect, and a clearly defined role to what started 25 years ago as a grassroots, whatever it takes service. Role definition made it possible to develop and evaluate competencies needed to provide quality family peer support, and new training is in development to address those needs. Research on quality indicators further informs the training and program evaluation, and the credential has helped pave the way for family peer advocates and family peer support services to integrate into a variety of new settings like primary care, hospitals, clinics, and child welfare and juvenile justice settings. We have developed through this some quality indicators. Sorry, I'm going a little over. I have them listed here, and we're working with those quality indicators, and they've opened up a discussion about how and where family peer support can have the most impact. And here are some examples of the quality indicators that we've come up with. Some are program-related, and some are individual family peer advocate quality indicators. So that's, and here are some resources and some contacts for us. My name is up there, and Families Together website and some other, important groups.